Welcome to Veteran Connection, VA Butler Healthcare's cable show. We bring important news and information to our veterans and friends of VA Butler Healthcare. I'm your host, Cynthia Closkey. Thanks for tuning in today. Our focus this episode is on Vietnam veterans and Agent Orange. Our guest is veteran Ronald Cepek. Ron was born and raised in Pittsburgh, PA, and he is twice retired. He has 20 years of military service as a Sergeant First Class in the Pennsylvania National Guard and 27 years as a lieutenant in the Zelienople Police Department. Ron served multiple tours in Vietnam as a door gunner, rifleman, and squad leader. After a frustrating initial experience with the VA many years ago, he decided to give the VA another chance and now comes to the VA for all of his health care. Welcome, Ron.
Well, thank you.
Thanks so much for joining us today.
My pleasure.
Tell us a little bit about your military experience.
Well, as you said, I spent 20 years in the military. I did 6 years with the regular Army, 3 of which were spent in Vietnam. I did 2 years with the Army Reserve as a military policeman, and then I had a 7-year break in service before I found a cavalry unit in Pennsylvania Army National Guard, where I went for 12 years and retired from there.
When did you first come to VA Butler?
Actually, about 15 years ago, and the experience left me somewhat disenchanted. I don't know if I was more disillusioned or disappointed, but and I left. I didn't pursue it any further. I came to the VA because my father-in-law, who's retired military, he suggested I get on the Agent Orange list, and I thought, well, you know, I'll look into it, but what really propelled me to do it was a friend of mine who had served with me in 1969. I found out that he was suffering from Agent Orange, and he got diabetes and lost several toes. And I thought, well, Michael was there. He didn't go anywhere that I hadn't been in front of him, and I was there twice as long, so I thought, you know, there might be something to this. But after being frustrated here, I didn't return. And about 2 years ago, they opened the health clinic in Cranberry. I received a call and was invited down to an open house there, and they made an appointment for an examination. And when I went there, it seemed to me that the VA had changed dramatically. It improved dramatically, because I was just treated with a lot of respect and consideration, and everyone seemed to go out of their way to see if I had problems and they could help me. So I started with a number of programs here at the VA, and I've continued with them, and I have some claims that are filed and pending right now regarding the Agent Orange issue.
So you've participated in the Agent Orange registry exam?
Yes, I have, and currently I receive some benefit from Agent Orange problems. One is I have the ischemic heart condition, and they're checking into the diabetes with me right now.
What other programs have you been participating in?
The PTSD program, which I found very worthwhile. It was another thing that I had never realized that I may have had a problem with, and it was a real eye-opener to find out that there could be some problems there resulting from PTSD. It was something I probably didn't want to really recognize, but now I'll admit to.
Which of the programs that you've been involved with and services have most helped you?
I really value the PTSD program. The people there, that both our counselors and the other service members that are there, particularly the service members, I do enjoy being with them. I feel the camaraderie. I feel that regardless if they were soldiers, sailors, Marines, or airmen, to me they're all, I hold them all in high regard, and they're my brothers. That's how I view it. And the staff that takes care of us have done an outstanding job, I think, of helping us along. I've also participated in some programs here for physical therapy for injuries I've sustained through the years, 20 years in the military. shattered an elbow, and I've had some problems with my legs, my knees, my ankles, and my back, and I've participated in several programs of physical therapy as well.
And that's helped you?
Hopefully.
It's an ongoing process. Always.
It's an ongoing process.
If we have veterans watching who are thinking about this, what advice might you give them?
Absolutely participate. Take advantage of it. You owe it to yourself. You're entitled to it, and you owe it to yourself. So by all means, you should take part. If nothing else, come out, get familiar with it, and judge for yourself. This is a worthwhile program, and the VA is here to help us, and I firmly believe it, and I'm thankful for it.
We're thankful for you. Thanks very much.
You're welcome.
Now let's talk with Martin Sweeney. Martin is a VA social worker and a Vietnam War veteran. Thanks for joining us today, Martin.
Thank you.
Are Vietnam veterans who have never come to the VA still eligible for VA care?
Yes. The VA categorizes veterans in 8 different classes, so that the lower, and it's by income, so that the lower 2 classes that are at or below the poverty line come in and there's no charge. Then it's graded upward, and then the upper classes in terms of priority are denied service if they exceed a certain income level or they're going to be billed fully for that service then. Vietnam veterans, however, are excluded from any of those categories principally because there's the presumption that they've had an exposure to Agent Orange.
Which issues do you see most frequently with the Vietnam War veteran population?
I principally deal with veterans with post-traumatic stress, and then it would be Agent Orange type of physical or neurological types of disorders, and veterans with depression.
Are you able to help veterans with disability claims?
Yes, I try to. Especially if I see a Vietnam veteran who's newly come into the agency. I always check the lab work beforehand to see what kind of results are turned up. You always have to have your lab work before you're seen here. And I also check the problem list to see and determine whether they're going to be eligible for any type of service connection. Because once you have a service connection, there's a degree of compensation involved with that together with eligibility for different services at the VA.
Some family members we hear sometimes think, a Vietnam veteran should be over it by now, that the Vietnam War was 40 years ago. But we know differently. Can you help the audience understand why some Vietnam-era veterans might need longer than others to come to terms or to recover from their experience?
The pattern that I've seen with veterans with post-traumatic stress is usually there's an acute phase shortly after discharge, and that might go on for a period of time. And then the veteran begins to settle down. He gets into gainful employment. He meets a girl, he gets married, he starts raising children, and his time becomes very structured. Right now we're trying to pick up the people initially when they're coming back from Iraq and Afghanistan and deal with this problem when it's still fairly acute. However, what happens is over time as a veteran ages and he gets further along in his career and his children are raised, maybe they're out of the home, his wife gets part-time employment or she's full-time employed, and his career is winding down and he has a lot more time on his hands and he starts doing a little bit more thinking about what his past experiences have been. It's kind of like human nature to kind of start reordering your life as you're aging and look at things a little bit differently than you did initially. And what's happened in the meantime is when you're initially in combat or early on after discharge, you're still viewing enemy as in a kind of a dehumanized manner. You know, they're gooks, they're slant eyes, but and currently ragheads and guys going around in man dresses. So there's kind of a dehumanization when you're looking at what the enemy soldier was like. However, after you get married and you start raising your own children and you have a lot more experiences in dealing with close family members, then you start, the process is that there's a humanization of what you did to the enemy, and there's more of a thinking about what that person might have been like and what his family is going through, or how did they suffer as a result of his death or captivity. So then there's a lot of guilt that comes in. So you have the big hump when people are discharged, when they're having all kinds of acute problems with PTSD, and then there's kind of a latent stage that it goes through. And then later in life, it becomes acute once again, and then there's a lot of guilt and anger and rage associated with it. So we do see a lot of people, Vietnam veterans, who come in later in life, and there's a big hump of older veterans coming in, as well as the younger guys from Iraq and Afghanistan.
So it really does make a lot of sense that this is the time when people might want to consider coming in.
Yes, and how do you erase an experience? How do you erase a memory? A memory can fade, but it can come back in great detail and vivid memory.
Now, we've mentioned a couple times also Agent Orange. Can you talk a little bit about what exactly that is?
Early on in the war, the command became concerned about troops and supplies coming down from the north who were in great support of the war. And in an attempt to determine the way they were traveling down, they called it the Ho Chi Minh Trail, they decided to use defoliants, which would make them more visible from the air or the ground. Yeah. Later on, it developed that they theorized that if they sprayed Agent Orange on croplands that were in South Vietnam, then they'd cut off their supply of food, which only really served to anger the South Vietnamese, because most of the people traveling down from the north are carrying their own supplies on their back.
And so with that, now what related health problems are we seeing from people who were exposed to it?
Well, when a Vietnam veteran comes in here, we try to get them into the registry, and we set them up for an appointment, which consists of a physical examination and a detailed social history of what his military experiences were in Vietnam. And the purpose of the physical examination is to establish a baseline of what kind of problems that person has. At the current time, there's 15 specific diseases that are regarded as presumptively caused by Agent Orange. And it's not the defoliant per se, it's a byproduct of the defoliant, the dioxin, which is contained in the defoliant that was used over there. And that's a known carcinogen. So of the 15 diseases, approximately 7 of them are different forms of cancer, and the others are either physical type problems or neurological problems that develop as a result of the exposure. The one that affects family members that's recognized is if a male Vietnam veteran has a child with spina bifida, that's presumed to be related to Agent Orange. And the way they develop these presumptive diseases is they do epidemiological statistical studies of 100,000 Vietnam veterans versus like 100,000 non-Vietnam veterans versus 100,000 members of the population, and where they find a statistical significance of much higher rates of different illnesses in that particular cohort, then they'll assume that it's presumed because of the exposure. That'll be the one thing that's different, the exposure to the dioxin in the Agent Orange.
Now, you mentioned earlier that veterans do not need to prove Agent Orange exposure, kind of like what you had, but it could be if you were anywhere in the area, you might have been exposed, and so then you're eligible.
Yes.
What can veterans with health concerns, whether it's about Agent Orange or other things from Vietnam, what can they do?
I guess report to the nearest veteran VA medical facility or outpatient clinic. And like I say, if you're a Vietnam veteran, you're automatically eligible for services because of the presumed exposure.
What would you like our viewers who are veterans watching today, is there anything you'd like to tell them?
I'd reinforce what Ron said, and that is it's a different VA than it was years ago, because I remember my brother returning from Vietnam, and he had suffered an injury as a result of getting thrown out of the back of a truck when someone threw a hand grenade into it. And I remember taking him to the VA hospital down in Wilkes-Barre, and they gave us a very hard time, almost implying that he had not been in service, and yet we went down and we had a picture of him in a field hospital in Vietnam being awarded a medal by a general, and on the back it stated the names and the unit he was in and the medal that he received. So I never had much to do with the VA.
When was that happened?
This was in 1968.
And so now, though, it's very different.
Yes, yes. The VA has really learned a lot from the Vietnam experience, because they did lose an awful lot of veterans who got turned off in coming to the VA. So that now, when a veteran is returning from Iraq or Afghanistan, there's outreach workers that go down to their armories and meet them and get them to sign up for enrollment at the VA. So to bring them in, and then they're given 5 years of non-chargeable services.
Thanks so much for sharing this information with us, and thanks for your message for veterans.
Thank you.
VA Butler's Health Promotion and Disease Prevention Manager, Karen Dunn, has joined me to talk about health and wellness. Hi, Karen.
Hi, Cindy.
So we're talking today about limiting alcohol.
We are, Cindy. Limiting alcohol is one of our healthy living messages.
What health risks are associated with drinking?
For heavy drinkers, they have a higher risk for liver disease, depression, stroke, and several types of cancer. Alcohol is a major factor in injuries such as fractures from falls and drownings, sexual assaults, suicide, and motor vehicle crashes. According to the CDC, the Center for Disease Control and Prevention, excessive alcohol use is the third leading lifestyle-related cause of death for people in the United States every year.
Now you're mentioning heavy drinking as opposed to drinking. How much is too much?
Well, the recommendations for females are no more than 1 drink a day, which would be your 7 drinks a week. And for males, that's no more than 2 drinks a day or 14 drinks per week. And to put that into perspective, 1 drink is going to be about 12-ounce beer, 8 to 9 ounces of a malt liquor, about 5 ounces of wine, and probably about 1.5 ounces of your 80-proof hard liquor.
Now, what is binge drinking?
Binge drinking is defined as more than 3 drinks on one occasion for women and adults that are over 65. For men, that would be more than 4 drinks on any one occasion.
Who should not drink alcohol at all?
This list is long, and for obvious reasons, children and teenagers shouldn't drink alcohol. Anyone that's planning on driving, operating machines, or taking part in any kind of an activity that requires attention, skill, or coordination, because I'm sure most people realize that those things are altered when you're under the influence.
People joke that, oh, I play pool better when I'm drinking, but in reality, it's just a perception that's changed.
Exactly. Some other people that shouldn't drink are people of any age that cannot limit their drinking to the recommended levels. Also, women that are pregnant or women that are thinking of becoming pregnant shouldn't drink. And anyone that's on certain medications that interact with alcohol. And the recommendation for that would be to check with your physician. I know when you get a prescription, it will say on the bottle, you know, avoid alcohol while taking this medication. But it's good to ask on any medication if it's okay to have alcohol with the medication. Some other people that shouldn't drink would be anyone recovering from alcohol dependence or that is already an alcoholic.
It is quite a list.
Yes.
But it's really important.
It is.
If a veteran is worried about how much he or she drinks, where can they find help?
Well, they can always talk to their healthcare team at VA Butler Healthcare, and they can direct them to whatever services we have available here at the VA. Effective treatment could include individual counseling, group treatment, medications, inpatient or residential treatment. If they're just looking for general information on how to limit their alcohol, they can always check the website for the National Center for Health Promotion and Disease Prevention, and that's www.prevention.va.gov. There's also a nice booklet that we have available here at the VA, and you also can get the information online from the National Institute on Alcohol Abuse and Alcoholism, and it's called Rethinking Drinking. So they can either look that up online or ask for it when they come in for an appointment.
Terrific, Karen. Thank you.
Thank you, Cindy.
Veterans who are registered with My Healthy Vet and who have upgraded accounts are now communicating with their healthcare teams using secure messaging. Secure messaging is a privacy-protected message service through the My Healthy Vet portal. Dr. Peter Silvas is an early adopter of secure messaging. He also participated in one of the pilot patient-aligned care teams to implement it. He's here now to tell us about this. Welcome, Dr. Silvas. Thanks for coming in today.
Oh, you're very welcome.
How long have you been using secure messaging?
About a year. We started putting the program together winter, spring of last year, worked out the bugs. My group and my patients were among the first to adopt it, and now most of us are using it.
Oh, what percentage of your patients communicate with you in this way?
Not many yet. I would say about 5% or so. But again, I can see up to about 1,000 to 1,200 people a year, so 5% of that is still a healthy number. And it's a good way of getting around the telephone or phone tag or any other barriers to communication.
What exactly is it?
Well, it's a web page. It's also a means of talking back and forth like the instant messaging or texting that people would do. The biggest concern, however, is it's private. There are no risks of identity theft or finding information. A patient of mine could go in, log in with his or her information. He or she could look up any of the last office visits, any of my lab work, any medications, really any time of day. Then you have the question of the instant messaging. If I have a question for my doctor and it is low priority, it doesn't have to be done immediately, and if it's about 2 or 3 sentences worth of information, they can get a hold of me within a day or two, get an answer within a day or two, and that's not clogging up the phone lines. It's also not me playing phone tag, so it gives you a chance of exchanging information in a very discreet manner whenever you want.
So what kinds of message topics do you find you're resolving through secure messaging?
Standard, basic questions, side effects, doses, what the patient is doing with other doctors in the community. It is not meant for I'm having chest pain or my house is on fire. By the time I respond to them, bad things would have happened. It is specifically, again, my medication refills, dose adjustments, or patients who are being escalated or dropped down on medications and telephone is either inconvenient or redundant. And so far it's worked well.
How does this improve the access to care for patients?
It changes the ratio of incoming phone calls. Really, you get rid of the low priority, low critical phone calls, and you get better service for the patient who has to call the operator or call the scheduler. And if you really need just a 2-sentence answer to clarify something, you get a much more concise and permanent answer. It's on your screen at home, so if there's any questions, you call the doctor back, but you're not on the telephone, you're typing.
So you're really sure if you have a nagging concern, did I remember that right? Did I hear that right? It's right there whenever you want to look at it.
Correct. And if there's a clarification about office visits, notes, or instructions, it's right there in black and white for you.
So what do you say to veteran patients to encourage them to try this service, to try secure messaging?
If you're young and savvy enough with a computer, if you possess a computer, if you're willing to use something to bypass the telephone, it's wonderful. And the setup is very brief and relatively painless. Staff here would more or less guide you through it, and as long as you have a phone, internet, modem, you can reach us any way possible, either by voice or by typing.
Fantastic. Thanks very much, Dr. Silvas.
You're welcome. Have a nice day.
With me now is Ken Kalber, Acting Associate Director for Operations at VA Butler Healthcare. He's ready to answer questions from our veterans. What question do we have today?
I'm a Vietnam veteran with type 2 diabetes. Could this be related to Agent Orange? Yes, it could be related to Agent Orange. Type 2 diabetes is one of the diseases VA recognizes associated with Agent Orange. If you served in Vietnam where Agent Orange was sprayed, you don't have to prove that you were exposed to Agent Orange in order to get VA healthcare benefits. You're also eligible for a complete physical examination. For more information, you may call VA Butler's Vietnam Veterans point of contact at 800-362-8262, extension 4437, or visit their website at www.publichealth.va.gov/exposure/Agent Orange for more info.
Thank you. If you have a question that you'd like us to answer in a future episode, please email it, vetconnect@zoominternet.net. And with that, we wrap up this episode of Veteran Connection. Thanks to our guests today, Ronald Cepek, Martin Sweeney, and Dr. Peter Silvas. Do you need more VA Butler news and information? Of course you do. Visit our website, www.butler.va.gov. You can also friend, like, retweet, or just follow VA Butler on our social media pages, facebook.com/VAButlerPA and twitter.com/VAButlerPA. Please also join us for our monthly podcasts at talkshoe.com/TC/85029. You can listen online or by phone and download past episodes. Thank you so much for joining us today. Check your local cable listings for the next episode of VA Butler Healthcare's Veteran Connection, where we're making lives better every day.